Hello, welcome back to this channel where we talk about the basic medical information making a big difference. If you are new here, kindly subscribe, hit the notification bell down below so that you get to be notified each and every time I upload a new video. And for the returning subscribers, thank you so much for always coming back to check on this channel. And my name is Rebecca Morangi, and this is the best place to be. We have been talking on medical information, which I believe if you are well equipped, you will not go wrong, and you'll be able to tell somebody or to advise somebody on what to do when faced with a certain medical condition. And majorly, we have dealt a lot on the thyroid gland generally, but today we are going to shift a bit and look at what we call Helicobacter pylori, also you can call it H. pylori infections. Welcome back, and take your time, relax, and let's get moving. Now, when we talk of H. pylori, what do we mean? Or when somebody, we say he or she has been infected with H. pylori, what does that one mean? Helicobacter pylori is a bacteria which actually infects your stomach mucosal lining, and mostly it's the common cause of stomach ulcers or peptic ulcer. This Helicobacter pylori mostly it affects many people, and some of them do not even realize that they have it because they never get sick from it. Many times people ask, why do we take children to the hospital, young children, maybe below 10 years, and then among the many lab requests which have been requested by the doctor or maybe a specialist, a gastroenterologist, you get there is H. pylori as one of the tests, and others ask, why is the doctor deciding to do this test? This is a young child. He or she may not be having this infection. Today, you should know that this Helicobacter pylori bacteria mostly affects young children, and to be specific, less than 10 years. Why? This is a bacteria, as we have said, and it's mostly actually found in saliva, on plaque, which is on your teeth, even on the stool or poop, if you can call it like that. And also, it's found in vomit. If somebody vomits, you can get that bacteria. Now, that bacteria can spread so fast. How? If you have mentioned it's found in saliva, so when you kiss somebody, you can transmit the bacteria if you have it. If you shake somebody's hand who has visited maybe the toilet, and he or she, or if it's a child and has not washed the hands thoroughly, you can spread that bacteria. And also, if you use contaminated water and food, you are also at a risk of getting this bacteria. So anybody can get this Helicobacter pylori infection through those ways. And also, this bacteria actually can be treated with a combination of antibiotics, at least 2 antibiotics. Reason being, maybe that bacteria can resist one antibiotic. So that is why we get it being treated with the use of at least 2 antibiotics and 1 proton pump inhibitor. These are acid reducing drugs or medications. Let's move on and look at the symptoms. How does someone present? Symptoms actually, if somebody has got what we call gastritis, that is the inflammation of your stomach mucosal lining, where yet you get irritated or you have a swelling. Now, symptoms, some people can have a burning sensation in the stomach. Others can get what we call a lot of stomach pain, which becomes worse when you have not eaten or you have not taken any meal. We have dyspepsia or indigestion. We have dark stools. Some people get stools, and dark stools, it can be maybe somebody is bleeding internally. Others can get what we call weight loss, unintentional weight loss. And that is if you have this bacteria and it has eaten your intestinal lining, your mucosal lining, you can lose weight unintentionally. So those are some of the symptoms of this bacteria. Maybe before we look at the tests which are being done, let us look at the way this Helicobacter pylori affects you or causes damage. One, the bacteria multiplies in your stomach lining, mucosal lining, and even in the small intestine. When this bacteria multiplies, it releases an enzyme called urease. This enzyme will convert urea into ammonia. This ammonia will protect the bacteria from the harsh environment, the stomach acidic environment, causing the bacteria to eat into your stomach lining, causing more harm. And remember, the bacteria is protected from the stomach acidic environment. So it will continue multiplying, eating you, and then it will cause even the soles in your stomach lining. It will damage your stomach mucosal lining, causing gastritis and even gastric ulcers. That is the way this bacteria causes damage in your body, and especially in your stomach or the duodenum, that is the upper part of the small intestine, and even the esophagus. Now, what are the tests now? How is this bacteria detected? We have two main ways or tests which are being performed at the hospital setting. One is stool test, what we call H. pylori antigen test. This is where a stool sample is required, or the patient will give a stool sample to the lab attendant, and then the lab will do a test to detect whether there are these antigens or proteins which are responsible for causing H. pylori. If the bacteria is detected, you are treated. You are going to see the way or the modes of treatment. And also there is a common test. Many of the people have gone through this test. So when I mention it, you can be able to understand more about it. What we call upper endoscopy exam. Now, this is where a patient is given medication first to relax, and then a tube, which you call an endoscope, is inserted down your throat to the stomach and even to the small intestine, the duodenum. This tube is flexible. It's a thread-like, very flexible. It's attached. Actually, the endoscope, it's a camera. So this tube will go down your throat, down to the stomach, and even the duodenum, the first part of the small intestine. This test will even detect anything or any problem in the upper respiratory tract. And also, during this examination, some tissue is removed to be taken for maybe a biopsy. So that is how this test is performed. We have others. We have breath test. Breath test is where, maybe this is not common, but the common ones, I've just mentioned them. This is where the breath test, you are given a certain liquid or a pill, and then you take it. It's tagged with carbon molecules. Now this one will detect the amount of carbon you release out. Now, after getting some of these tests, how can this H. pylori be treated? Treatment can be done in different ways. One is through antibiotics, the most common one. Those who dispense drugs over the counter, and in my day-to-day activity, that is mostly what I do. We get prescriptions which a doctor or a specialist has prescribed, what we call H. pylori kit. H. pylori kit, we have different brands. There are a lot of brands in the market, many of them. And these brands, they have been combined with at least two. You get at least two antibiotics I mentioned earlier. And the reason being is to avoid what we call, this bacteria can resist one antibiotic. And then there is a combination of what we call proton pump inhibitor. This is acid reducing drugs or medications. So antibiotics, at least two antibiotics. Common antibiotics, we have amoxicillin, we have clarithromycin, sometimes we have tetracyclines. Now, like doxycycline is an example of a tetracycline. So the antibiotics will deal with these bacteria. So we have gotten one. In this H. pylori kit, we have at least two molecules of antibiotics, and then we have another drug we call proton pump inhibitors. Proton pump inhibitors, these are acid-reducing medications. They reduce the amount of acid in your stomach or in your body. Now, example of these proton pump inhibitors, we have omeprazole, esomeprazole, rapeprazole, pantoprazole. There are many, you can name them. Now, and then we have other medications. We call them bismuth subsalicylate. Now, this bismuth subsalicylate, actually what they do, they cover your mucosal lining, stomach mucosal lining, to protect it from the acid or acidic environment. So they cover. And mostly when these medications are dispensed, if you are given this molecule or medication under this class, you are told to take it before meals on an empty stomach. Reason being, it will cover, if you have an ulcer, that is a sore which has been caused by the acid in your stomach, caused by this Helicobacter pylori bacteria, it will cover it and protect the mucosal lining. So that is why you are told, take it before. We have histamine 2 blockers. That is another type of medication which is used to treat this. Histamine 2 blockers. The way I say blockers, actually, these are medications as they protect or they prevent acid from being produced. So these histamines, they are acid producing in your body. So when they are blocked, they not be able to produce this acid. Those are some of the medications. Remember, we have mentioned antibiotics, at least 2, PPIs, proton pump inhibitors, bismuth subsalicylate, and then histamine 2 blockers. And then when you are given these medications, you are told to adhere to the dosage. Remember, we have mentioned resistance of the bacteria. If you don't take the medication well, it will resist this. The bacteria will resist these antibiotics. And you still have this bacteria affecting you more and more. Again, so you adhere to the timing, the dosage, and the duration. Mostly these medications, actually, they are given for at least 2 weeks. 2 weeks, so you take for 14 good days. You have, yes, they have side effects, but the body, sometimes your immunity will be able to deal with those side effects. And if side effects come because of maybe of the drug interactions with the food you take, so some people feel even more worse. They feel bad when they take this medication. They are on the course of this treatment because of these drug interactions, all drug and food interaction. But at the end of the 2 weeks, you will be able to feel better. Now, some people ask, how am I supposed, this comes a long way when you are dispensing these drugs. Are there some foods I'm supposed to avoid? Maybe before we move on, from my personal experience, one day, actually, I took a patient to a specialist. And then I remember we are told, if we give you a list of some foods to avoid, at the end of the day, you'll find that you have told you to stop most of the important foods your body needs. And what affects you, actually, it might not affect the other person. So with me, I can advise, this is over-the-counter advice, not a specialist, but on my own day-to-day activities. Whatever you take and you feel like it affects you, that one you can avoid for some time, because this bacteria will be dealt with the medication you have already taken. And after some time, maybe at least after some 4 weeks, if you repeat this test, you'll be able to find that you're okay. So, but there are some foods you are told to avoid in the course if they affect you. So if you take this medication and then you are taking some foods and then they get to affect you, you avoid for some time. Now, let's move on. What are the risk factors of these bacteria? One risk factor we mentioned of these bacteria being found in contaminated food and water. So if you take contaminated food and water, you are at high risk of contracting this H. pylori bacteria. So you take clean water, and then your food, make sure it's not contaminated. Another thing, if you live in a clouded environment, especially in developing countries, I don't know where we will rate our country or your country. In developing countries where you get sanitation, it's a big issue. This, you can be at a high risk of contracting these bacteria. Another thing, if you live with somebody, the same house, the same environment, who has got this bacteria, and then maybe you shake hands. Remember we mentioned on the way this bacteria spreads. Somebody visits the toilet, comes back without washing, like young children when they are at school. I know there are those who don't really take care of especially the young ones. You can get this bacteria. It will spread too fast. So if you live in an environment, clouded environment, those who visit latrines, the toilet, and they don't wash their hands, this bacteria will spread so fast. So it'll be at very high risk. Clouded environment, contaminated food, not taking clean water, and then living with somebody who has got the bacteria in the same house, you are at risk of getting these bacteria. So those who ask questions, how do I get this bacteria? How did it come? Those are some of the ways you can contract or you are at risk of getting this bacteria. Yeah, what are the complications? Now, when you have got this bacteria, Helicobacter pylori, we mentioned the way it damages. It causes damage in your body. The bacteria causes damage in your stomach lining by eating into the mucosal lining, and then it will cause sores. And these sores are what we call ulcers. So one of the complications you will get if you have got this bacteria is ulcers. An ulcer is a sore which has been caused by this Helicobacter pylori. Another complication is what we call gastritis. Many times when you go to the hospital, your specialist or your doctor tells you, actually maybe you don't have this, what you have is what we call gastritis. Gastritis is the inflammation of your stomach lining, the irritation which is caused by the acidic environment or these bacteria, the Helicobacter pylori. You feel very uncomfortable. You get irritated. Sometimes you get a swelling. That is one of the complications. You get stomach cancer. That is one of the complications of this Helicobacter pylori. Up to this level, I believe you have gotten some information or some background of Helicobacter pylori. The questions maybe we do ask, sometimes they have been answered in one way or the other. If you have a question, you can type it down below in the comment section. We'll be able to answer it sometimes. Give us your experience. Have you ever been in this category? Have you ever gone to an hospital and then you are told you have Helicobacter pylori infection? How does it feel? How was your experience? Give us your experience. Some people ask, how long will I take for me to know that now this bacteria has cleared completely? If you take antibiotics, another thing actually I forgot to mention, when you are being tested, if you are on antibiotics and then the doctor decides to do a test, sometimes these antibiotics will interfere with the results. If you are on PPIs, proton pump inhibitor, acid reducing medications, they will interfere with your results. So sometimes it's good to, if you are on medication for the 2 weeks, wait for at least 4 weeks again to repeat the test. How can I prevent this bacteria? We have mentioned prevention is by improving your lifestyle. Lifestyle by taking foods which are not contaminated with these bacteria, or clean foods. Take clean water, clean supply of water. Clean water, sometimes you've been those who drink water. Get boiled water. There are those who take maybe mineral water. Live in environments which are not overclouded. If you do that, you'll prevent that. Prevention. Sometimes somebody has contracted H. pylori in your house. See the way, improve your cleanliness in the house. Let that person take the medication. Let that person complete the dosage. If it's for 2 weeks, let that child or an adult complete the dosage. So lifestyle will improve your lifestyle, will improve or prevent this bacteria. You can create or make a difference in your life by not getting this bacteria, by improving your lifestyle changes. Getting this information can equip you or can place you in a better environment. Get to visit into health facilities, get to ask questions, get to know more, get to read more about H. pylori bacteria. These are just a fraction of dealt with. You can read more, get informed, because information is power. The basics, when you get the basics, you will make a difference to somebody else. Let your children know that they can get these bacteria by not washing their hands correctly. When they go to school, help them. If you remember, during the COVID-19 era, the level of infections, even these H. pylori infections, I remember we used not to even dispense H. pylori kits for the time this problem hit the country or the different countries. So when we improve cleanliness, we lower these bacteria, all infections. But at least if you've gotten it, visit the hospital. We mentioned the symptoms. If you feel like, or you feel you have these symptoms, nausea, you lack some appetite, you have dark stools, you have a panning sensation in your stomach, visit the health facility near you. You'll be able to get helped. Sometimes people take antacids. Antacids, sometimes they help to manage this condition. If you get a panning sensation, you take antacids. So sometimes when you are given these medications alongside, you are dispensed with an antacid to manage the problem, to neutralize the environment, the stomach lining. Thank you so much for always checking on this video. I believe at this level, you have gotten something which will help you, kindly share the link down below. Kindly don't forget to subscribe. Don't forget to subscribe. Give this video a like. I mentioned sometimes back, the likes helps me in one way or the other to create this content. It motivates me. Your company motivates me. Let's meet in the next video. See you. Don't miss. Your company matters. Bye bye.